Hi everybody, Justin Feldman, Feldman Physical Therapy and Performance. We got Corey here from Gold's Gym, and we're going to talk a little bit about cupping. So we've been getting a ton of questions from patients, we've been getting a bunch of emails, Facebook questions, and I knew it was serious when my own sister texted me to ask what in the world this cupping thing is. And it's been getting a lot of popularity in the Olympics. You've been seeing these crazy marks on people, and most notably Michael Phelps. I think the cupping has turned into the kinesiology tape of the Rio Olympics, so now everybody wants to know what it is and whether or not they should use it. We did a little bit of a podcast episode answering some questions about it, but wanted to do a little video. So we got Corey here, and you're seeing this cupping on people. They're getting these huge red marks on them, and that comes from a different type of cupping than really most people use and isn't that beneficial. So that comes from people using glass cups where they heat them up and creates this huge suction cup effect on their skin. The kind of cupping that we use a lot here, what we're going to do is we're going to roll Corey's sleeve up here, is we're going to do a little bit more of an active type of cupping. So I might put some of this lotion here on Corey's arm, use a cup, and I can pull and I can get a pretty good suction on his skin, and then I can move that around, and basically it just provides a different type of stimulus to his skin, something he's not used to, and it might make the area a little bit less sensitive. It might make it tolerate more beneficial types of treatment. We're not really going to get a lot done with this, but you can see it kind of just creates a real loose suction, and then you can use multiple cups and pull back and forth. But it's not the type of cupping. You can see you're going to get a little red mark, and then basically that should fade away right away. We don't recommend the type of cupping that you're seeing these people get, where they get these huge red marks on them, and that comes from leaving that on there. And basically what they'll do is they'll put something on there a little more strenuous and get that on there, and then just leave the room and walk away for a while and let them just rest there. And you start to see these big red marks, and we want those things to go away. But the idea is we might use this for somebody who's not tolerating a different type of treatment, who, when we start to work on them, their muscle spasms and they get really tense, and it starts to limit our ability to do other things. So it should be pain-free, and it should feel kind of good and relaxing. It's not something that should be painful. That hurt at all?
No.
All right, that's all. Any questions, definitely feel free to reach out. Thank you.